There's a man at a pharmacy counter, doing math he shouldn't have to do. He has a chronic illness. The drug that keeps him alive costs a few dollars to make. He's being asked for hundreds, so he does what millions quietly do. He rations it, takes less, skips a day. Some people who play that game don't come back. Now hold one number. A drug like his can cost about $10 to make. By the time it reaches that counter, the price can be $1,000. $10 to make, $1,000 to buy. And here's what took me weeks to believe. A huge piece of that gap never reached Big Pharma at all, or his pharmacy. Someone else took it, someone you've never heard of. I've been working this case for weeks, and like last time, I started out chasing the wrong suspect. Stay with me, and I'll show you who really sets the price of staying alive. One question by the end. If the pill costs $10, where did the other $1,000 go? Case number 6, the same drug, the same factory. Americans pay far more than anyone else on Earth. A vial that's $30 in Canada can run $300 at a US counter. Other rich countries make their government negotiate one price for everyone. America handed that job to private middlemen instead. Americans fill 6.5 billion prescriptions a year. On almost every one, a cut goes missing between the factory and the counter. And the drug maker, the company everyone blames, often never sees that cut. So I stopped chasing the logo on the box and went looking for who takes the cut. For weeks, this case had me chasing the wrong name. You've heard Big Pharma your whole life, but the evidence kept pointing somewhere else. Between the drug maker and you sits a second industry. It doesn't make drugs. It doesn't research them. It doesn't dispense them. It decides what you pay. They're called Pharmacy Benefit Managers, PBMs. 3 of them handle almost 8 in 10 prescriptions in this country. 6 handle more than 9 in 10. Together, they control the drug coverage of about 270 million Americans. 40 years ago, these were small back-office firms that just processed paperwork. A wave of mergers turned a niche service into a choke point on nearly every drug in the country. The Federal Trade Commission spent years on this file and called them its words, powerful middlemen inflating drug costs. How they actually set prices is a black box the FTC had to subpoena its way into, and almost no one outside the industry knows their names. So who are they? So let me finally read them into the record. CVS, Caremark, Express Scripts, OptumRx. Each is owned by a healthcare giant. CVS Caremark belongs to CVS Health, which also owns the insurer Aetna and thousands of pharmacies. Express Scripts belongs to Cigna. OptumRx belongs to United Health. All 3 parents are giants. 2 of them, CVS Health and United Health, rank among the 10 largest companies in America, bigger than almost any drug maker they buy from. Together, the 3 take in over $1 trillion a year, which means one company owns all 3 pieces of the chain. The insurer that pays for your drug, the middleman that prices it, the pharmacy that hands it to you. Same house, 3 doors. So when they negotiate your price, they sit on both sides of the table. The referee, the scorekeeper, the player. Same owner. But owning the chain is just the setup. The real money starts the moment the medicine moves.
Clients put out, you will see a half dozen or more PBMs that are competing aggressively for that business, and we have to continue to extract value out of pharmaceutical manufacturers to show that value to people.
When you control every prescription, you don't make money one way, you make it many. 1. The rebate. The middleman tells the maker, want your pill covered? Pay us a kickback. So the maker inflates the sticker price to cover it. The higher the price, the bigger their cut. They profit more when the price goes up. They also decide which drugs your plan covers at all. A medicine they leave off the list barely exists, so makers pay to get on it, and pay again to keep cheaper rivals off. Take insulin. In 1923, its inventors sold the patent for $1. Banting said, "It belongs to the world." A century later, one common insulin climbed from $21 to $275, up more than 1,000%. In 2024, the FTC sued all three middlemen, saying their rebates artificially inflated insulin prices.
It is not a cure. It is literally what keeps me alive. Without insulin, I am dead.
In the United States, at the time, we were using insulin pens, so a little bit different than.
And here's the proof it was never about the cost. The moment public outrage forced a $35 cap, the price fell almost overnight. The whole climb up was a choice. 2. Spread pricing. They bill your insurance one price, pay the pharmacy less, and keep the gap. About $1.4 billion on a single batch of generics, the FTC found. 3. Self-dealing. They route the most profitable prescriptions to pharmacies they own, marking some up thousands of percent.
5,000% above NADAC, HIV 4,000% above NADAC, heart failure, a modest 161% markup above NADAC. These are not aberrations, Mr. Joyner.
The FTC found generics that cost a few dollars, billed to plans for hundreds. On 2 cancer drugs alone, $1.6 billion above cost in under 3 years. 4. Clawbacks. Months after a sale, they reach back and pull fees out of the pharmacy. Charges so unpredictable, a small drugstore can't even tell if it made money on your prescription. And on top of it all, fees to file, to fill, to exist. Across just the drugs the FTC studied, the markups pulled in over $7 billion beyond cost. That's the machine. Quiet, legal, built into the price of staying alive. And I assumed someone would switch it off. That's where this case nearly broke. To be fair, the middlemen say they fight the drug makers and lower costs. And for some big employers, sometimes they do. But that's not who pays the price. For years, a gag clause in their contracts legally barred your pharmacist from telling you that cash would be cheaper than your insurance. One study of 9.5 million claims found that in 23% of them, going through insurance cost more than just paying cash.
Price. And I think every one of us has experienced going to the pharmacy counter and being told by a pharmacist standing in front of a computer, this won't go through, or you're going to need to pay $300. I know your copay for medications is supposed to be $10.
It took an act of Congress in 2018, passed 98-2, to outlaw it. And the corner pharmacy is dying. Middlemen reimburse independents below cost on about 1 in 5 prescriptions. In 2024 alone, more than 3,000 pharmacies closed their doors. When Congress quietly dropped PBM reform from a spending bill in early 2025, more than 300 pharmacies closed in the next 10 weeks alone. Today, nearly half of U.S. counties have a pharmacy desert, places with no easy access to a drugstore. The chains the middlemen own do just fine. And every time Washington moves to act, the lobbying machine roars to life. These are some of the largest companies in America. They spend tens of millions a year keeping the rules exactly as they are. So where did the other 1,000 go? To someone who never made the medicine, never cured anyone. They just stood in the doorway and charged a toll. And the ones who pay most are the ones with the least. Today, 1 in 4 Americans on insulin still skip or stretch their doses to save money. Since 2017, advocates have documented at least 14 people who died rationing insulin they couldn't afford.
Next day or two. On June 22nd, Alec went to the pharmacy and left without his medications. We believe he felt he could stretch out his remaining insulin until his payday on June 30th. From his bank account record.
Not in some poor country. Here, in the richest one on earth, over a drug that was given to the world for $1. Remember the man at the counter? He did everything right. A job, insurance. The system just wasn't built to get him the medicine. It was built to meter it. We were told the villain was Big Pharma. The real one was 3 middlemen most people can't even name. In 2026, the FTC forced one of the 3, Express Scripts, to settle and change its terms. The cases against the others are still open. It was never the cost of the cure. It was the toll on the way to it. Whether that gate ever comes down is no longer a mystery, only a choice. Case stays open. The investigation continues.